Are you the internal medicine resident on call?
Yes, why did you page me at 2 o'clock in the morning?
I'm the emergency room resident on duty. There is a 30-year-old male patient who needs to be admitted to the hospital.
Okay, what is wrong with the patient?
He has abdominal pain.
Okay, can you tell me more?
The abdominal pain is very severe.
Where is the pain?
In his abdomen.
Yes, can you tell me anything helpful?
The triage nurse ordered a CAT scan of the abdomen and pelvis before bringing the patient back from the waiting room.
What did a CAT scan show?
The radiology resident called from his house. He was upset, then I woke him. He had to get up and go to his computer next to his bed. He says the CAT scan shows inflammation with fat stranding around the appendix and some free pelvic fluid.
What did the labs show?
The ED panel includes a CBC, chemistry panel, INR, D-dimer, urinalysis, and pregnancy test. His white blood cell count is 28,000 and his bicarbonate is 10. His pregnancy test was negative.
Anything else about this patient I should know?
He has a fever of 104 degrees.
What is his abdominal examination like?
His CAT scan shows inflammation with fat stranding around the appendix and free pelvic fluid.
What do you think is wrong with this patient?
I don't know, I just don't know. He is sick and needs to be admitted to the hospital.
Did you call the surgery resident on call?
Yes. The surgery intern came to see the patient. He thinks the patient has viral gastroenteritis and needs to be admitted to medicine.
What do you think?
I don't know. I just don't know. He needs to be admitted to the hospital.
The patient has appendicitis and needs to go to the OR tonight.
The surgery intern does not think so. He says to admit the patient to medicine.
I don't think that makes any sense.
It really does not matter what you think. The patient has already been assigned a bed on the medicine floor under your name.
I can't operate on this patient. What am I supposed to do with him?
I don't know, I just don't know.
Why don't you admit the patient to surgery?
Surgery will not take the patient. He is sick and needs to be admitted to the hospital. The chief of the Department of Internal Medicine says that anytime a patient needs to be admitted to the hospital and no one else will take the patient is to be admitted by the internal medicine resident. Are you the internal medicine resident on call?
Yes.
Then you must admit the patient to the hospital. When you are finished admitting that patient, I have another patient who the neurology resident says needs admission for a stroke.